How you feeling, bud? How you feeling?
Good.
Good. I'm so glad. Do you know what's going on? Do you know what's going on? Do you know where you are?
Turquoise.
Turquoise. Yes. Turquoise. Do you remember the animal?
Rhino.
Oh my goodness. You passed the test. Dad is going to love this.
My throat feels weird.
Yes, your throat feels weird, and it's going to feel weird just for a little
That
bit.
was awesome.
What was awesome?
Surgery. I can't remember anything. Can I feel my face?
I didn't touch it yet. Yeah, because you have your little, you know, where the moles were. Yeah, they look so good. You don't even need
to take a picture.
Yeah, I'll take a picture. I'll totally take a picture. You remembered the animal and the color. You passed the test. You beat anesthesia.
That was awesome. I want it again.
What did you like the most?
I feel really dizzy.
Yeah, dizzy's okay. Go ahead and put your head back so you don't feel so dizzy. Just kind of rest. Okay. What did you like most about surgery? Do you remember going to sleep?
What did you say?
Do you remember going to sleep? Probably not, huh?
I was like, I'm resisting it. I was like,
yeah. Yeah, you tried to resist it, and we all told you, good luck with that, huh? How do you feel right now? A little sleepy?
tired.
Tired, yeah. I'm really impressed that you, yeah. Got that on your
Why is there
finger?
a Band-Aid on my
Well, why do you think there's a Band-Aid there?
a mole?
Yeah, that mole is the only one that needed a stitch. Has little stitches in it. Everything else doesn't have any.
Stitches on my face?
No stitches on your face. You feel okay about that?
I still feel really tired.
Yeah, you're tired. No, don't. Let's not touch your face. You should feel tired, honey. You're just coming out of anesthesia. You're just waking up. You're gonna feel a little funny today. You good? I told you it would feel funny, huh?
Okay. Can I see my face?
You can see your face. Yeah. I'll show you in a minute. I want you to tell me your favorite part about all of this. Do you have a favorite part?
Yeah.
What is that? What's your favorite part of surgery?
Dang.
Hey, bud, what's your favorite part of surgery? What are you doing? What are you doing? You okay? Are you okay? Mm-hmm. Did you have a favorite part of surgery? Or did you just kind of like all of it?
I remember breathing in and I was like...
You remember breathing in?
I tried. I tried resisting it.
Yeah, you tried resisting going to sleep? Yeah. Why'd you try to resist it? Just because you wanted to beat the system? You just wanted to prove... Why are you doing that?
Shit, look at my face.
You're trying to look at your face? Are you okay, bud? You're good.
My throat feels weird.
Yes, your throat feels weird. And if
I'm so hungry.
I bet you are. Are you cold?
No. I want to see the video.
You want to see something? I'm doing a video. I'm doing a video because you're definitely going to want to watch this later. For sure. Because you will not really remember waking up. Right now, you're going to be giggling, watching yourself. You okay?
Add stitches.
Yeah. Yeah, you got stitches right there in your arm.
On my face?
No, not at all.
Oh.
Not at all on your face. No stitches in your face. He said it was so easy. He said you did really well. He took care of all of them.
All of them?
All of the moles are gone.
Not all of them.
Yeah, all of them. Yeah, the ones that we took off. There were 13 of them. And they're all gone.
My eyes want to sleep.
Yeah, well, you can just sleep. You can
I can't?
Yeah, you can rest. You can rest. What do you want to eat? What sounds good to you? What sounds like the best lunch ever? What do you want to see?
There's still a VIP in me.
Yeah,
I don't even feel it now.
I know. You shouldn't feel a whole lot of anything. Just tired. Do you feel loopy?
Wait, I remember guessing the two animals, didn't I?
You guessed the color and the animal, and you guessed them both right. I didn't even ask you. You just were waking up and you said, turquoise. And I said, oh, what's the animal? And you said, rhino, yeah.
It feels so weird.
I know you feel weird. It's okay. That's just normal. Super normal for coming out of surgery. Do you feel okay, though? Are you uncomfortable at all?
Did they look at my privates?
No, they didn't look at your privates. Good thing, huh? Are you cold? I'm wondering if you're cold.
I'm not that cold.
You're not that cold. Let me...
The medicine.
The medicine definitely can help you feel funny. There, we'll keep you warm. What is that? Do you know what it is?
Where's my throat? Like, whenever I swallow, it feels kind of weird.
Yeah, the reason why is because the anesthesia, in order to keep you asleep, they had to...
Whoa!
What is it?
It's a PVC.
It's a PVC?
That's all I can read.
You saw PVC?
Do I have stitches?
No.
I don't.
Not in your face.
He's like, I'm just gonna give you a little battle scar. No, you said battle scar. That I'm gonna
No battle scars.
stitches because they're like flat.
Okay. Oh, don't touch. No, you're good. You're good.
It's wet.
Oh, yeah. Yeah. No, you're good. You're good. Totally fine. You're totally fine. It's wet because they put some, like, ointment on it.
Why they put ointment on my face?
To help it heal. It just helps it to heal.
It's antibiotic ointment.
Yeah.
Right.
It's all good.
You doing okay?
Why so battle scars? Or...
No battle scars. He was just messing with you. I think that Dr. Becker was just messing with you. No battle scars.
I want to keep this thing forever.
And why do you want to keep it forever?
So I'm like, yeah, it looks so cool.
Does it? You want to show it to everybody? Oh, let's not touch your face. Yeah, let's not touch it.
Can I go back to sleep?
You totally can. No, you're good.
No, it's hurting. I mean, it's squeezing my arm.
Yeah, it's squeezing your arm because it's checking your blood pressure, and it's super normal. You like that?
No.
Okay. What was the hardest part about all of this? Was there something about surgery that you didn't like?
The AF.
The AF?
And my arm
Yeah,
shot.
it's called the IV.
IV.
Yeah, close enough.
Yeah, really close.
Yeah. You're really smart, Porter.
Oh yeah, I forgot about that one.
Yeah.
Did it hurt?
It's all there. Everything's still, all your body parts are still in place. Did it hurt? It doesn't matter. You don't touch anything.
What the what?
Yeah, what the what? It's just there. It's just monitoring you, and you're good. You feel good? What do you feel right now? What do you feel? Do you feel?
What do I feel?
Yeah. Do
My throat feels kind of weird.
Yeah.
To like start breathing in. I remember a mask going like this, and I was like,
Yeah. And that helped you to be sleepy.
and then I was like this, and I was like,
yeah. Okay. Just take your time.
I see what my moles look like.
You want to see what your moles look like?
Oh, why did it keep shaking?
Oh, this is normal. That's totally normal for coming out of anesthesia.
It's not even cold in
Yeah,
here.
it's not. Nope, it's not a cold
This
thing.
doesn't hurt anymore. What they
It's
do?
great. It's fantastic.
Like it's kind of hurting again.
And then it doesn't. Yeah.
Look at that.
Look at that.
Look at the blood.
Yeah. Yep.
Am I really allowed to go back to sleep? Like right now?
You can totally rest. At some point, we're going to need to leave the hospital, though,
Why?
because we're going to want to go back to Cousins.
I really like this.
I
This is
know.
my favorite part.
That's your favorite part of all of surgery? You like that more than the IV?
You know what I want right now?
Hmm?
You know what I want right now?
What?
Pizza.
What?
There's no pants on.
No, you're good.
Did they look at my private?
No. 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 No, they did not. Nobody did. You've had your underwear on the whole time, and all they saw was your skin on your belly and your back and your face and your neck. All the.
Did
and
they
the
see
arm.
my abs?
Yeah, they saw your abs.
What does my back look like?
Yeah, let me look. Oh, it looks good. Looks like you removed them all. So how do you feel knowing that they saw your abs?
Oh, great.
Yeah, good thing those abs are in good shape. Huh. He has his favorite part of all the surgery is this right here.
Love it.
You do love it.
Good.
Do you have any questions? Like, is there anything that you're wondering about?
I forgot about this one.
That was the biggest one.
That's the only one where you have a stitch.
So is it cancer?
No, sweetheart. They're taking all those back.
I thought they just found out, like, they took it off, they put it in a machine, and it's cancer.
They sent it off to what's called pathology.
How long will that take?
Next week.
Look
Next
at-
week we'll make sure and we'll know that everything's all good. Okay? You're shaking, which is normal. Super normal coming out of anesthesia. Okay? So that's a good question. Do you have any other questions? We'll know that when we go back to see Dr. Becker next week.
You know what? I just figured out what I want to eat.
Okay?
Pizza and sausage. I mean, sausage,
Okay.
pizza,
Mm-hmm.
root beer,
Okay.
and then ice cream after.
Okay. So sausage pizza with root beer and then ice cream. That's a nice smile.
Did you see it?
What am I looking at?
Oh, I didn't get braces.
No, you didn't get braces. You did not.
Ew,
No.
why does my cheek feel weird?
I don't know.
You know the last thing I remember?
Tell me.
Dr.
Becker.
Becker was like, open your mouth. And I was like,
Oh, yeah.
and then he said something about that, he said something about a tongue hole. And I was like, what's that? And I was like,
Oh, okay. Yeah. Yeah, he did. He talked with you. He had you open your mouth because, and that actually wasn't Dr. Becker, that was Dr. Hassan, the anesthesiologist. Dr. Hassan had you open your mouth.
okay, but why does my mouth feel kind of weird?
Because you had some things in your mouth to keep you breathing and good during surgery. Does it feel weird? Does it feel like maybe you got braces?
It feels like, you know?
No. Tell me. What does it
Oh,
feel
I
like?
forgot to say it.
It's okay.
Feels like gooey stuff was on my right here,
Yeah.
like on my tongue and on the side of my cheeks.
Yeah, totally.
There's one like
Another
recordings.
I don't know
Oh,
why
yeah.
my IV doesn't hurt anymore.
Isn't that so great? Oh, this is a warm blanket. There you go.
Ooh.
Oh, that feels snuggly. It's like when it comes right out of the dryer.
I was gonna ask her if
Oh,
I can go
do
to
we have-
sleep.
Oh, you can go to sleep. You can rest. But we do want to leave the hospital.
Why?
Because going home is such a good idea.
What time is it?
Right now,
Because I remember coming here at 11:30 somehow.
we came here at 10.
But he was like,
11:30 was surgery,
yeah.
and now it's probably like.
You have your phone.
I do have my phone. I could look, except I'm recording you.
Oh yeah, I forgot.
Yeah. I wonder if you're gonna remember any of this.
I feel so naked.
Well, but you're not. You're wearing underwear and you have a hospital gown. No one saw your privates, as you call it. And you didn't get braces. And your mouth feels funny and you want pizza with sausage and ice cream.
Mm.
Yeah. And you're doing really good. Everything's super normal as you're coming out of anesthesia.
You know what just occurred to me?
Tell me.
If you did a handstand and farted, would you fall over?
What do you think?
I think it depends how good you are at handstands. If I was doing a handstand and I farted, then they'd push me over.
Possibly, if the fart was really strong. Is there a reason why you're thinking about handstands and farts?
Hi. I kind of just farted, but also just handstands are good.
They are good.
They are
Handstands
good.
Yeah, they're great.
Am I allowed to move?
You totally can move.
Like,
be
get
really,
out?
Well, you want to be really gentle because you still do have the IV. What you looking for?
My abs.
Your abs look fantastic.
Oh, yeah.
You really work hard
I
on
got
them.
stitches right here.
You did. And I do think you already knew that. I think you did already
I
know
did
that.
know that.
Yeah, I think you remember it.
But I thought I was gonna get stitches on my face. He was like, "Yeah, those are so smooth. We just give them stitches."
Nope, you don't need stitches there. It's so perfect. It really works out very well. Pretty cool, huh? Okay. Well, do you have any other questions? Any final thoughts?
Can I take this off?
Nope. You need
Can
to
I
keep
keep
that on
it
your
on
hand.
forever?
Nope. Nope.
Can I? Oh, is Wendy gonna bring me some chocolate chip cookies?
Oh. Would you like chocolate chip cookies?
A little bit.
A little bit. That'd be so nice, huh?
Guess what?
Tell me.
You never told me a friend, did you?
No, I didn't.
But I remember the blue and the rhino.
The
turquoise and the rhino.
The turquoise and rhino. And you totally remembered. I didn't say a friend's name, but I'm going to tell you a friend's name right now.
Mm-hmm.
Okay? The friend, the name that you need to remember later today I'll ask
But
you.
I'm fine now.
No, I think you're fine now, but sometimes we don't remember coming out of anesthesia. Okay, the name is Savannah.
Savannah?
Mm-hmm.
I have to remember that.
You
name.
do. Mm-hmm.
When are gonna
Later today. Just sometime tonight. Yep.
And I'm not even gonna bring it up.
Nope.
Like, I'm not gonna start talking about it.
No. Speaking of friends, are you so excited for school? Right? School starts in 2 days. 8th grade, big man on campus.
In 2 days.
In 2 days.
Oh.
It's awesome, huh? You've been looking forward to this, so it'll be perfect.
Where's Dad?
Dad is in surgery with another patient. You're good.
Oh, I'm fine.
You are fine. Yeah, you're good. Okay, it's just squeezing your arm, dude.
I know.
Okay, I think you're definitely waking up well enough. Do you think you're going to want to watch a 20-minute video of you coming out of anesthesia?
Maybe 15 minutes,
I
but
know. So,
I'll watch it.
yeah. Who else might want to watch this? You think cousins? Do you remember that cousins are at
Cousins, Dad, and people on airplanes.
people on airplanes? What would they like about it?
'Cause you know Delta videos?
Mm-hmm.
They're super funny.
Mm.
So if this is super funny,
Mhm.
I'm gonna.
So, Delta.
Can I buy this?
I would not bite it. No.
No.
So you think that Delta, the airline company, would like to show this video to all of the people on the airplane?
Yeah. No, don't do Delta. Do Hawaiian, so they have a really nice time going to Hawaii.
That's a good idea.
And then it's like a perfect vacation.
Because they watched something funny on their way to Hawaii.
If it's funny.
Well, we don't know if it's funny.
Why do I even have this?
Well, just it's monitoring your pulse.
Just for fun.
Oh yeah.
Looks pretty fancy.
Mm-hmm.
Oh, I thought it was attached to my ribs. I was like, oh, but it's not.
I don't think anything's attached to your ribs. I think it's just,
It's attached to that thingy.
yeah, could be. Got a lot of machines around here. All right, dude. I'm gonna stop the video. Do you have
Wait.
Any, do you have any final questions or comments?
Oh, guess what?
What?
It's military time on there.
It is
See how
military
it says
time.
1301?
There you go.
That means it's 101.
You are absolutely right.
My mouth feels so weird right now.
I know.
I was like talking. And I was like talking, and I was like,
Okay, I have a question for you.
what?
If someone else is having surgery, which advice would you give them? What advice would you give them? What would you tell them is the best way to have a good experience with surgery?
Don't resist it. It's impossible. Also, if ask if you can keep this. Also, get stitches because they look cooler. And I thought I'd have battle scars, but you know. Did I just touch my mole?
You're good.
I thought I touched.
Okay, so that's your advice. And one last question. How do you predict your 8th grade year is going to go? What do you think it will be like?
Perfect. Because
Why?
well, you see, since I have the moles gone on my face, I'm less ugly.
Oh, dude.
And then,
Dude. You were
What?
never ugly. You're funny.
less ugly. It's not like I was ugly. It's like, I was like, you're like, oh, you're an okay hot. But I mean, now that the moles are gone, I think I'm going to have a better year.
Okay.
But my class doesn't have a lot of my friends.
Mm-hmm.
Except Josh. I mean Calvin.
Calvin.
It has Calvin.
Mhm.
And it has William Stanger.
Yeah. William. Yep.
And then the rest are in the other class.
Yeah. So you have some friends in your class, and you have some friends in the other class. You have awesome friends. It's possible your awesome friends will be watching this.
Mm-hmm.
How do you feel about that? Yeah?
So let's talk about braces.
Okay.
Can I get them?
We can go see an orthodontist, and we can have that looked at, and we can make an assessment and a decision based on that time with the orthodontist. Okay. Sounds good.
Okay, I really do like this thing.
I totally know that you do. Yeah, it's cool. Really awesome.
You know what I didn't like?
What?
IV.
You didn't like the IV because why?
Does my hair look good?
Your hair looks so good. It totally does.
Hey, buddy.
Hey,
How we doing?
good.
Pain, nausea, anything?
My mouth feels weird.
Yeah, that's from that tube that they had in.
They put a tube in my mouth.
They did.